Bismillah ar-Rahman ar-Rahim. Severity of acute asthma. Severity of acute asthma classified into moderate acute asthma and acute severe asthma and life-threatening asthma, then near fatal asthma. First, moderate acute asthma. It's characterized by the following: increasing symptoms, peak expiratory flow rate is more than uh, or equal to 50 to 75% of predicted, and no features of acute severe asthma. 1 hour following treatment in accident in the emergency room, patients with peak expiratory flow more than or equal to 75% of predicted. It can be discharged home with appropriate changes to asthma medication in the absence of concerns such as significant ongoing symptoms, compliance concerns, living alone, psychological problems or learning difficulties, previous near fatal asthma, nocturnal presentation, pregnant patients, exacerbation despite adequate oral steroid pre-presentation. So again, if the patient of this moderate severe asthma given treatment in the ER and after 1 hour the peak expiratory flow rate improved to more than or equal to 75% of predicted, then the patient can be discharged, except in the following conditions. If there is significant ongoing symptoms, means there is no improvement in symptoms, compliance concerns, if the patient is not compliant to treatment well, if the patient living alone, if there is psychological problems or learning difficulties, or there is a previous history of near fetal asthma or a nocturnal presentation, if the patient also is pregnant, if there is exacerbation despite adequate oral steroid pre-presentation before the presentation of the condition, and the patient on adequate dose of corticosteroid, and in spite of that, exacerbation occurs. Regarding acute severe asthma, acute severe asthma characterized by or defined as any of the following: the peak expiratory flow is 33 to 50% of predicted. The respiratory rate more than or equal to 25. Heart rate more than or equal to 110, and the patient is unable to complete sentence in one breath. The patient can also be discharged if responded well to initial treatment. The life-threatening asthma, the other classification or the third classification is life-threatening asthma. Life-threatening asthma defined as any of the following: if peak expiratory flow below or equal to 33% of predicted, if saturation below 92%, and that need arterial blood gas, of course, and needed ABG, if PaO2 below or equal to 8 kPa, if the CO2 is normal. Okay, don't mess. If normal CO2, this means life-threatening asthma. The range of normal CO2 is 4.6 to 6 kPa. If the chest is silent, if there is cyanosis, If there is poor respiratory effort, apparent poor respiratory effort, if there is bradycardia, arrhythmia, or hypotension, all these signs or any one of this previous presentation, we consider it as life-threatening asthma. Again, life-threatening asthma, any of the following. A peak expiratory flow below equal to 33% of predicted or best. Saturation is below or equal to 92%, and that sign need arterial blood gases, of course. PaO2 below or equal to 8 kPa. If the CO2 is normal, it's very important sign. Normal CO2 means that the patient is life-threatening or has life-threatening asthma. The normal CO2 ranges from 4.6 to 6 kPa. If the chest is silent, if there is cyanosis, if there is poor respiratory effort, if there is bradycardia, arrhythmia, or hypotension. Also, if there is exhaustion or altered conscious level, this means life-threatening asthma. What is the near fatal asthma? Last classification here, last grade of classification. Near fatal asthma. In near fatal asthma, the CO2 or PaCO2 is raised, and or if the patient needs mechanical ventilation with raised inflation pressures. Okay, but any one of these two signs or these two manifestations means the patient has near fatal asthma. If there is raised PaCO2 and or needing the patient need mechanical ventilation with raised inflation pressures.